Assalamu alaikum, my name is Munir, and today we will be talking about the mediastinum. So, the mediastinum is basically the space between the left pleural cavity and the right pleural cavity. For its borders, it has the sternal border, which is anterior to it, the thoracic vertebra, which is posterior, so front. Oh yeah, we also have the thoracic outlet at the top, and at the bottom we have the diaphragm. So we can divide the mediastinum into four parts divided by the angle of the V, which is where the second limb attaches to the sternal body or in between the fourth and fifth thoracic vertebrae. And it can be divided into the superior and inferior mediastinum. Now, the inferior can be further divided into the anterior, the middle, and the posterior. Now, as for the superior mediastinum, in the anterior we have the thymus, we have the left and right brachiocephalic veins. In the middle we have the aortic arch and its vessels, as well as the vagus and phrenic nerves. Also, the trachea is found in the middle. While it is posterior to the thymus and the vessels, overall it is found in the middle superior mediastinum. In the posterior, we can find the esophagus, the left recurrent laryngeal nerve, as well as the thoracic duct. Now, in the superior mediastinum, we have an upper part and a lower part. The upper part containing the left brachiocephalic vein and the lower part containing the aortic arch. Why should we care? Well, essentially, when we collect the bone marrow sample to check for leukemia, we can pierce a little too deeply, and this will affect the part that is posterior to the external body. The other part, it's this, the other part, it's the edge. Now, the inferior mediastinum. We're going to start with the anterior, which contains the thymus gland, as well as the peristernal lymph nodes. That's what we call the lymph nodes behind the sternum. The thymus gland is where we produce the T lymphocytes, which mature the T lymphocytes, which produce antibodies to antigens, only found in kids because it undergoes involution during puberty and is replaced by fat tissue. In the middle mediastinum, you can find the heart surrounded by the pericardium, the roots of great vessels, as well as the arch of the azygous vein. In the right part, you can find the right and left phrenic nerves, but only the right phrenic nerve in the right part. And you can also find the superior inferior vena cava. Here we see an actual image of what it looks like, and as we can see over here, we have the azygous vein. This is how we identified that we're looking at the right part. We can also see the sympathetic trunk between the sympathetic ganglia as well as the esophagus. Now, as for the superior vena cava, it will drain contains all the venous blood from the head, neck, and upper limbs, and is joined by the azygous vein, one tributary, which is basically a vein that runs along an artery branch, and by the union of the right and left brachiocephalic veins, and those consist of the subclavian veins as well as the internal jugular veins on either side. Now, as for the azygous vein, we have the hemiazygous veins, which will join to the azygous vein that will join to the superior vena cava. They drain blood from the intercostal spaces, the bronchi, and the esophagus. We have the inferior vena cava, which drains blood from the lower half of the body, pierces the diaphragm to the central tendon at the vena cava foramen at level 2. We have the pulmonary veins, which basically return oxygenated blood from the lungs to the left atrium of the heart. We have the aorta consisting of an ascending and arc in the descending part, what was pointed out was at T8, the inferior vena cava will go through the diaphragm, at T10, the esophagus goes through the diaphragm, and at T12, the descent of the aorta is left. The ascending aorta will almost immediately split off into a right and left coronary artery, and also obviously eventually become continuous with the arc. Now, as for the arc, it will split off into a left subclavian, a left common carotid, as well as a brachiocephalic, and the left vagus nerve is in front of the aortic arc, but goes behind the root of the left. We have the thoracic aortic aneurysm. The most common area for it to occur is where the aorta begins to descend. It's caused by a fibrosis of the ligamentum arteriosum, which is the remains of the ductus arteriosus. We'll get to that in a second. But essentially, it will cause dysphagia, which is difficulty swallowing, difficulty in breathing, and it can be felt by palpating the trachea at the sternal march. Now, the thoracic aorta will branch off into bronchial arteries, esophageal arteries, pericardial and superior phrenic arteries, but mostly you should focus on how it branches off into posterior intercostal arteries and subcostal artery, all of them except for the first two, which branch off into coastal cervical trunk. Next, we have the pulmonary trunk, which splits off into the right and left pulmonary arteries, and it essentially takes the oxygenated blood to the lungs. We have the ligamentum arteriosum, which is the remains of the ductus arteriosus, which is present to take blood from the aortic arch to the pulmonary trunk, and is found in the fetus. Now, patent ductus arteriosus is what happens when the ductus arteriosus doesn't close. It is caused by high prostaglandin E and oxygen. It is also caused by the rubella virus, rubella infection. Now, it leads to cyanotic defects, which can show themselves as a bluish color, especially in the lips of the baby. We can treat it through ligation, but we do run the risk of potentially damaging the left recurrent laryngeal nerve. Any unintentional damage is known as iatrogenic injury, and it essentially can cause hoarseness due to the paralysis of the muscles in the larynx. Now we have the esophagus, and we only have to keep 2 points in mind: is the fact that it's in the posterior mediastinum, as well as it is the arc of the aorta goes to the left. So while the esophagus is in the midline, to the right of the aorta in relation, basically. We have the thoracic duct. All the points were mentioned in the previous lecture. And we have the phrenic nerves, which arise from the C3, C4, C5 nerves. They run anterior to the root of the lung, whereas the vagus nerve is posterior. So essentially, we're saying that the phrenic nerve is in front and vagus is behind. Oh yeah, it also innervates the diaphragmatic motor nerves. So when we cut them, we essentially can't breathe, and we will require a ventilator to help us mechanically breathe. We have the vagus nerve, which descends from the thorax to the superior and posterior mediastinum to form the esophageal plexus at T10 before continuing to form the anterior and posterior vagal trunk. Next, we have the vagus nerve, where we have the left recurrent laryngeal, which will approach the aortic arc and hook around it lateral to the ligamentum arteriosum, and it ascends to the neck and supplies all the intrinsic muscles of the larynx except the cricothyroid. Now, the right recurrent laryngeal will rise from the roots of the neck and hooks around the baby heart. And yeah, that was basically it.